All right, first thing I'm going to talk about are topicals. I have this topical pain relief roll-on, which is lidocaine, and this topricin, which is a homeopathic ointment. Will these things help? They very well may help to reduce your pain. Will they solve the problem of muscle fatigue and muscle tightness? No. May this help with, this homeopathic remedy help with some type of underlying inflammation? It might. If it helps reduce your pain, great. But I can't guarantee it, because again, nobody can guarantee that these pain relievers will help your pain. They may help, so you can give it a try. This here is naproxen, which is a non-steroidal anti-inflammatory I got over the counter. The other type of non-steroidal anti-inflammatory is ibuprofen. Another analgesic is Tylenol or acetaminophen. These help reduce your pain. So these non-steroidal anti-inflammatories can reduce inflammation. So if your pain and discomfort is actually from some type of tendinitis, an acute inflammation, these may be helpful, so worth it. Now remember, majority of pain is not due to inflammation, it's due to some muscle fatigue and muscle tightness. Even arthritis, which is many of us get as we age, is a misnomer. Not everybody has arthritis. They may have degenerative changes on the x-ray, but is it clearly arthritis? Clear arthritis is when you have inflammation, and there may be some low-grade inflammation, but again, majority of people who have degenerative changes on the x-ray don't have acute active inflammation. So even though these medicines are recommended for those conditions, what's even better is to improve your muscle strength and balance through physical therapy, and try to limit how many of these anti-inflammatories you take, because these do have potential complications. Now, some people, they do really well when taking one of these tablets a day and just gets them through the day, and you have to talk that over with your physician. So you can use these medicines, but remember, they can raise your blood pressure, cause problems and issues with kidneys, upset stomach. Acetaminophen can do things with your liver. So if you're taking these according to the prescription or according to the instructions, and your doctor doesn't know about it yet, please talk to your doctor if you're taking these for more than 2 to 4 weeks. Patches, lidocaine patches. So this is lidocaine patch from Aspercreme. You cut this open and attach it to the area of pain. This here is called Tiger Balm, which has camphor, menthol, and capsaicin. That might be helpful. Again, if these help you to reduce the pain and discomfort of the region so you can be more active, great. Give it a try. TENS units, transcutaneous electrical nerve stimulators. This I got at Walgreens. This one I got off of Amazon. This was 24 bucks. There's no special one that these have. You can just give them a try. These provide a little bit of electrical massage through electrodes. And I'll show you that one of them. Here, and let me put you down. So there's a little battery with the charger here, and you take this and attach it to your back, turn it on, and it can give you a little electrical stimulation. These can be very helpful. You're in a lot of control with these things. So I like these about that, because you can turn it on, you can turn on the intensity, and if it helps you, this can be really beneficial to allow you to improve your range of motion, because it's helping to massage the muscles, maybe help fatigue the tight ones so that you can have better range of motion. The Amazon one came in this box and comes as this nice little device here. It has 10 modes to it with these electrodes, and then you attach the pad to it. So you put these, and it comes with a number of pads because it has all these leads to it. So you attach these to attach the pads to the leads, you attach this area to your pain, turn the monitor on or turn the device on, and it has 10 modes. The instructions actually say to test all 10 modes and see which one works. So make sure that you read the instructions before you use these TENS units. You can go online to learn more about it based upon the products. I'll have a video soon on how to actually use this particular one, on what to do. If you have an electrical device such as a nerve stimulator or a pacemaker, please ask your doctor if it's safe for you to use these devices, TENS units, if you have one of those devices. Easy Reach massager that allows you to massage the muscles of your neck and back, and you can put it in your low back and maybe your thighs. There are a variety of other different things you can Google on. A common one is called Theracane, and if you Google that, you'll see a whole bunch of similar ones like that, and you can get it at Target, Walmart. Doesn't really matter. They have instructions on the web, and you can look at it. This is a way of doing a self-massage. Could be very helpful. Maybe you do this several times, and maybe you use the TENS unit and then use the lidocaine. So that's how you'd use these. So I'm just showing you a variety of things that you can get over the counter, because there's not one thing that will help with your pain. And if you ask a physician, what can I do for my pain? They will tell you something. Hopefully they'll tell you something, but even if they tell you something, there's no guarantee it will help you. And so you have to be aware of that. And the reason is because pain is 100% subjective. It's something you're experiencing. And we don't know to what intensity you're experiencing it. And you can tell us a scale of 1 to 10, and that tells us the intensity you're having it, but that doesn't let us know what medication or what thing over the counter will be helpful. And I have plenty of patients who come to my office who have tried all these medications and it's still not helpful. So, so that's one of the challenges about pain management. Now, the most common reason for pain is muscle fatigue and muscle tightness. That's why I started Dr. Rob Rehab, because the best way to improve muscle fatigue and muscle tightness is mobility activities that improve your mobility, strength, endurance, and balance, so that these muscles can begin to relax and the overworked muscles can underwork. The underworked muscle can finally start acting up and working, so there's more muscle balance, and when you have more muscle balance, you have better mobility, better spinal health, better spinal fitness, and that will help reduce pain and improve your quality of life.